What do you see as the advantages or the disadvantages of being a behavior analyst or a behavioral researcher in a province that doesn't really fully recognize that practice yet?
I'll start with the positive. I'll start with the advantages. And I see the advantages more of a behavioral researcher. I'm a much better researcher because I was in a non-behavioral department. There's no doubt about it. It made me learn to question assumptions that other behavior analysts don't question. For example, visual analysis. It made me develop expertise that I thought I would never have. For example, machine learning, which is really big in almost every other field. So working in a non-behavioral, and I'll say non-behavioral department, but I mean, there's not really, even in the province of Quebec, we don't really have a behavior analytic department anywhere. Really opened my mind to other methods that could fit within the radical behaviorism that Skinner promoted. I'm not saying that we're outside of behavior analysis, not at all. When I say that you open your horizons, is you see what others are doing, and then you say, how could I use the dimensions, the concepts of behavior analysis to explain the changes that they just seen, and how could I implement these in using a behavior analytic framework? And that has really opened my eyes, and just for that, I have no regret. Because the other part of being a behavioral researcher in Quebec is that it gets a bit lonely, obviously. I have nobody near my office to throw ideas at. When I get when my article gets rejected, because we get rejected as authors. In case you don't know, we get rejected all the time. So when it get rejected by like QCABA, I don't have anyone to complain about it, and nobody cares. And even that's the hard part. Like, for example, publishing in QCABA is not valued at my university because the impact factor is pretty low. So I mean, it gets difficult sometimes to explain what we do because people see single take cases, designs, and think that it's easy to do, and that I do this because I'm lazy. Because it's easier to do than a group design, which is not the case, because a lot of people just collect one big database and then exploit it for 10 years. I mean, I'm not sure it's, I'm always collecting data. So I think there are different challenges, one is not necessarily easier than the other, but it's to get people to understand what I do. And even now, when I first got the job at the University of Montreal, somebody said, "Oh, cool, you're here. We'll have somebody to teach cognitive behavioral therapy." They didn't know what I was doing. I was like, I have absolutely no skill to teach cognitive behavioral therapy. But it's just explaining to people. But I've been very fortunate where I am, where people have been extremely welcoming about it. It just gets really, really lonely. And there's also challenges related to data collection, obviously, because we don't have a clinic. So most big Ph.D. universities who are R1 universities with behavior analytic programs have a clinic on site of behavior analysis to collect data. I don't have that. So it's extremely difficult for me to compete and to maintain a high level when you have to rely on mostly non-behavioral oriented external programs to collect data, because you have to sell it, you have to send people in, it's a lot more expensive. There's issues with rooms, so it's a big challenge. I mean, like I say, there's advantages and disadvantages, but I really feel I am light years away as a researcher and a lot stronger and better as a researcher because I didn't work in the behavior analytics faculty. Because the issue, and you'll see it in some journals I will not name, it seems that they're repeating the same thing over and over again, instead of trying to, go out there and think outside the box.